So today we're going to be looking at the evaluation step of the strategic prevention framework in relation to the community health assessment process. A community health assessment is a systematic process involving the community to identify and analyze community health needs and assets, prioritize those needs, and then implement a plan to address significant unmet needs. This process is centered around community engagement, and community engagement is involved with each step. The purpose of the SPF evaluation step is to enhance prevention practice. It is the systematic collection and analysis of information about prevention activities to reduce uncertainty, improve effectiveness, and facilitate decision making. Evaluation helps communities to systematically document and describe prevention activities, meet the diverse info needs of prevention stakeholders, including funders, continuously improve prevention programs and practices, demonstrate the impact of a prevention program or practice on substance misuse and related behavioral health problems, identify which elements of a comprehensive prevention plan are working well, build credibility and support for effective prevention programming in the community, and advance the field of prevention by increasing knowledge base about what works and what does not. So evaluation is step 9 of the CHA process and step 5 of the SPF process. It is a way to review all of the hard work that is being done and identify what is working well and the impact, and what is not working, and to document this information so it can be shared out with the community and key stakeholders and utilized for continuous improvement. Here you can see an example of step 9 of the CHA filled out from the state's perspective. The evaluation on the SPF PFS grant is being completed through the information that is entered into quarterly progress reports and the MPDS. You want to be thinking about what questions you will be asking for evaluation and where you can find the answers to those questions. Filling out a logic model with identified community health issues, as well as risk and protective factors, can help to determine appropriate questions for your evaluation. Evaluation and the SPF. When designing your SPF evaluation, you want to ask questions at 3 levels. First, since a comprehensive prevention plan includes multiple programs and practices, examine separately how each was delivered and the degree to which it produced positive outcomes. Next, determine how well these different programs and practices are working together as part of the community's comprehensive plan to address priority substance misuse problems. Finally, evaluate the implementation of the SPF process itself, asking questions like, were all step-specific tasks completed? Were the principles of cultural competence and sustainability integrated along the way? Your evaluation should review everything that was implemented, as well as the SPF process that was followed to get there. This is a good time to note the importance of establishing a baseline as well. Identifying your baseline data before implementing your program or practice allows you to measure and understand the impact of your strategies post-implementation. The importance and benefits of involving diverse stakeholders in the evaluation process cannot be overstated. An evaluation stakeholder is anyone with something to gain or lose from a program or practice and its evaluation findings. This includes members of those populations that the prevention program or practice is intending to reach. By involving diverse stakeholders, prevention planners achieve the following: demonstrate respect for the many individuals and groups connected to prevention efforts, obtain the help and support needed to conduct a thorough evaluation, enhance understanding of the evaluation process among those involved in data collection and analysis, ensure the cultural relevance and appropriateness of the evaluation design, tools, and findings. Increase the credibility of prevention programming as well as the evaluation process and its findings. Increase the likelihood that evaluation findings will be disseminated and used. And garner support for any efforts to expand and/or sustain programs and practices that have shown to be effective. Involving diverse stakeholders in every step of the SPIF, including the evaluation process, is essential to integrating cultural competence and sustainability into your work and will provide insights that would otherwise potentially go unnoticed. Process versus outcome evaluation. Your evaluation should focus on both process and outcomes. Process evaluation is used to extensively assess the quality of implementation, keep implementation efforts on track, and inform adjustments that can strengthen the effectiveness of prevention efforts. Some common questions asked during process evaluation are: were programs and practices implemented as planned? What adaptations were made? Were the resources sufficient? What obstacles were encountered? Who participated and for how long? Outcome evaluation is used to determine whether the program or practice made a difference and what changed. An outcome evaluation might document changes in a population group's knowledge, attitude, skills, or behavior in both the short and long term. Some common questions asked during outcome evaluation are: what changes occurred? How the resulting changes compare to what the program or practice was expected to achieve? And how the resulting changes compare with those of individuals not exposed to the program or practice. Both process and outcome data are important. Outcome evaluation looks at results, but results don't tell the whole story. An evaluation that focuses only on outcomes is sometimes called a black box evaluation because it does not take the process into consideration. Examining process can shed light on disappointing or positive outcome results. Both are essential as you want to consider the process of implementation and the outcomes of the implemented program or practice so that you can paint the full picture and generate evaluation results which can be utilized going forward. There are 4 key principles in evaluation. They are utility, feasibility, propriety, and accuracy. These 4 principles and the actions listed below them on this slide when designing the evaluation need to be considered. Utility is about making sure the evaluation needs of the prevention stakeholders, including funders, are met through your evaluation process. Feasibility is about making sure your evaluation process is realistic and achievable. Propriety is about making sure the evaluation is conducted in accordance with legal and ethical guidelines and is consistent with each community's cultural context. And accuracy is about making sure the evaluation process is conducted in a precise and dependable manner. Think of these as principles or guidelines for your evaluation design that can help to ensure you achieve your intended objectives while conducting your evaluation. Keep in mind that there are many areas competing for the attention of community members and stakeholders. Here are some tips for effectively sharing out and communicating evaluation results. Develop succinct messages and share results and lessons learned regularly. Prepare messaging in a format that community members and stakeholders will be able to easily access and understand using precise and commonly understood language. Solicit feedback on how different populations are receiving these results and be prepared to alter as needed. Consider how you can combine your findings with other evidence to demonstrate the impact of your interventions on community health issues. Communicating evaluation results is key for maintaining and building capacity, as well as integrating cultural competence and sustainability into your SPF process. This raises awareness by showing the reasoning and results behind the work being done so that community and stakeholders can digest and understand the prevention work. Now is a great time to touch on the SPF guiding principles of cultural competence and sustainability. If we think of the SPF as a flower, these guiding principles can be thought of as the water and sun that the flower requires in order to survive. Without constant attention to these principles, the flower may wilt and die, but by emphasizing integrating these principles into the SPF process, that flower will bloom and grow stronger. So here are some ways to integrate cultural competence throughout the evaluation step. Conduct process and outcome evaluations to demonstrate whether selected programs are having the intended impact on identified disparities. Track all adaptations. Allocate the evaluation resources needed to learn whether the interventions you selected are having the intended impact on behavioral health disparities you hope to reduce. And conduct follow-up interviews with program participants to better understand your program's evaluation findings. Here are some ways to integrate sustainability throughout the evaluation step. Through process and outcome evaluation, communities can make important mid-course corrections to prevention efforts, identify which practices are worth expanding and/or sustaining, and examine ongoing plans for sustaining those practices that work. By sharing evaluation findings with community members and stakeholders, planners can also help to build the support needed to expand and sustain effective interventions. That's going to wrap up our presentation today on the Strategic Prevention Framework evaluation step. Thank you.